Breaks right here. Nobody is sounding any kind of an alarm. This is not a panic situation. Numbers are still incredibly low across not just the entire country, but in Ohio. But COVID is still happening, and that's why the new vaccine is so important. And that's perhaps one of the reasons we have been seeing lower numbers. Here are the latest numbers from the state of Ohio as they were updated late last week. You can see last week, 6,300 cases reported to the state. Keep in mind that 6,300 number is probably low. Those are only people who are going into doctors' offices, taking tests there, and they're coming back positive. But the good news is that is below our 3-week average. We are still seeing people being put in the hospital. In Ohio, 221, but again, below the 3-week average of 263. As far as people ending up in the ICU, it's about the same as the last 3 weeks. And then this is unfortunately the sad number. People are still dying from COVID or COVID-related deaths. They may have cancer and contract COVID and die as a result of complications from COVID-19. But that gets us to our conversation about where we are currently, and then some of the problems that people are seeing when they try and go out and get the vaccine. We're going to bring in Dr. David Margolius. He is the director of the Cleveland Department of Public Health. Dr. Margolius, how are you, sir?
Thanks, Dan. I'm doing well.
Thanks for coming on with us. We're going to talk about vaccines and insurance and the message that you folks are trying to get out. But let's first talk about COVID. We just went over the state numbers. COVID is unfortunately still around. It is still unfortunately causing deaths in many people. What is the message you want people to understand right now about where we are with COVID?
Well, just like you showed on those graphs, we're in a really good place. COVID cases have been going down over the last 3-4 weeks in Ohio, and really never took off in Northeast Ohio this summer. So we're in a good place, and we want to encourage people to be a part of the community, see your friends and family, go to work, and you can stay safe with that vaccine.
And that vaccine, let's talk about that. The FDA, the CDC working on a vaccine that is, I don't know if tailor-made is sort of the correct, or tweaked is sort of the term. What do you want people to know about the vaccine? It did take a little time for it to come out, just like we see the flu shot every year need to be tweaked and maybe is a little different. What is it with this vaccine? What has been done to it? What should we know?
Yeah, that's right. This newest COVID vaccine is the most up-to-date protection based on how the virus has mutated over time. Just like with the flu shot, viruses mutate over time, and we want to stay up to date. So the new vaccine came out, it's up to date. Unfortunately, it just hasn't rolled out as well as those COVID vaccines did during the emergency phase of the pandemic.
And let's talk about that. And that's really sort of where this next part of the conversation goes. We did see things move rapidly and smoothly when there was a national response. And it was because we were in a designated public health emergency. Why is that designation so important? Or what changes when we're not in a public health emergency?
Yeah, folks remember during the COVID, during the emergency phase, the vaccine would be approved, and then the next day they would be, basically in your arm or on the shelves, and you could line up to one of these mass clinics and get the vaccine. The emergency proclamation allowed us to do a lot of things, including giving away all that healthcare for free. Now that the emergency has been declared over, we're back to, unfortunately, back to healthcare as usual, and folks are have to navigate their own insurance system, to really be able to get healthcare.
And that's really one of the big differences, really, this fall compared to even last fall. Last fall, you could walk into it, did it myself, walked right up to my Giant Eagle pharmacy, asked if I could get the vaccine, waited for 5 minutes, got the shot, and that was that. That may not be the case. Let's talk about some of the hurdles that are there. Does every pharmacy, does every doctor's office even have the new and updated vaccine at this point?
By this point, probably most do. Most pharmacies will have it, but the challenge is, that pharmacy or that doctor's office might not be in your network. And so what we're hearing is stories of people who heard that the vaccine was free, like the COVID vaccine's always been free, and they walk into their pharmacy and they end up with a bill for $190.
And that would obviously be a shock and a surprise to people, especially when we're thinking about who needs this vaccine the most, our older population, fixed income sort of situation. To be hit with a $190 bill, that's going to come as a surprise. What do you want people to do? What should they know before even heading out or setting up that appointment?
Well, what we're hoping is that folks, unfortunately, will have to call their insurance company first, find out what's in network. Is it a CVS Minute Clinic or is it a CVS pharmacy? Is it their doctor's office or the pharmacy associated with their doctor's office? And then the second thing we're encouraging people to do is talk to friends and family who've gone through it already, share experiences, share best practices. And hopefully, over the next few weeks, some of these bugs will be worked out and the right path will be a clearer path.
In the past, we've seen public health departments give free clinics. Are we even doing that this year, or is that sort of how far removed we are from the public health emergency?
Yeah, that's we were doing really well with those free clinics and vaccines, but this year, as a result of the emergency being over, we only got 200 vaccines, and those vaccines are only for people with no insurance.
So
So
somebody,
unfortunately, we're not set up like we've been in the past to be able to set up these great community-based mass vaccination clinics.
Doctor, while we're talking about it, who really should be getting the vaccine? Are you recommending this vaccine, the new tweaked vaccine? Are you recommending it for everyone? Is this our older population, our immune compromised population? Who are you advising get this vaccine?
In particular, certainly if you're over the age of 65, I would make that appointment to get that vaccine. And chances are, if you're over 65, you have better insurance through Medicare than the rest of us on private insurance plans. So would certainly recommend, if you're over 65, get that updated COVID vaccine.
Anybody else that needs to be considering it? Obviously, people with immune compromised situations, people with cancer, fighting battles, probably want to get this. Anybody else?
You got it. Yeah. Well, it's recommended for everybody over the age of 6 months. But the highest risk folks are over 65, folks with any kind of underlying lung problems like asthma or COPD, emphysema. If you smoke cigarettes, you're at higher risk of worse complications from COVID. Open for everybody at this point, but in particular, if you're at high risk of getting severe illness from COVID, we want to make sure you schedule that appointment.
Excellent. We're speaking with Dr. David Margolius. He is the director of the Cleveland Department of Public Health. Dr. Margolius, we always give the final word to our guests here. What do you want people to know? What should they walk away with at the end of this interview?
Well, things are pretty good in terms of how we've overcome COVID in our community. We're at a much better place, and to continue to stay safe, check in on your loved ones, and go ahead and get that vaccine through the proper channels when you're able.
Excellent. Dr. Margolius, thank you very much for the time. We appreciate it.
Yeah, my pleasure. Thanks so much, Dan.
All right. Take care, sir. Again, just giving you the most updated information when we hear from our public health officials. And this has really been the concern. You heard Dr. Margolius say that they've had people, and they're hearing stories of people showing up to pharmacies. They get their shot, and then they get a bill in the mail for $190 because insurance didn't pay for it, or the rules that where we used to be getting free vaccines don't apply now because we are out of that designation of a public health emergency. So wanting to give people the heads up, make sure you're checking. If you do decide to get the vaccine, go through the proper channels, give your insurance company a call, find out what they deem as in-network. May be a big difference from just going to a local pharmacy as opposed to checking into your doctor's office. If we have any other breaking news, we're going to bring it to you here on our digital properties. Remember, our 3.5 hours of news starts at 3 o'clock on Channel 19, where we will have the very latest on all of the breaking news, especially that out of Israel, where the fighting and the missiles continue even while they are sleeping tonight in Israel. So we'll have the very latest on that on Channel 19 at 3. Until then, I'm Dan DeRose with 19 News Now. Have a great afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media at Cleveland 19 News.